Welcome back to the Ricky Matthews Show. I really enjoyed that conversation with Hunter Dawkins. He's, he's a terrific guy, and what he's doing as a small newspaper publisher is very impressive with the Gazebo Gazette. So we're thrilled to have him not only to be on this show, but also just as a resource for SuperTalk Mississippi, where he is not only a news contributor but also an opinion contributor. So great to touch base with Hunter from time to time. But it's Wednesday on the Ricky Matthews Show, and it's Singing River Health Talk. And today is going to be another great conversation. Listen, 65,000 babies have been delivered at Singing River since 1931. 65,000. That's pretty amazing. And so today we're actually going to be talking about maternity care at Singing River. And I'm thrilled to have Lori Weimer joining us. She is a specialist there. She's a patient care manager. She has a background as an RN, and we'll share more about her role and some of the really cool stuff that's happening as it relates to maternity care and infant care at Singing River Health System. So without any further ado, let me welcome Lori Weimer to the Ricky Matthews Show. How you doing, Lori? I'm
great. How are you?
I'm doing good. Where are you sitting right now?
I am sitting in my office currently, hoping that no one opens the door.
So are you in Ocean Springs or Pascagoula?
I'm in Ocean Springs.
That's cool. Listen, we were chatting a little bit before the show started. You're not originally from this area, and you had a family connection that was in the military that introduced you to this place, and you fell in love with it. But tell a little bit about how you decided that medicine was going to be your thing, and then how you ended up here.
Medicine for my thing has probably been my whole life. I just love taking care of people. How I got into maternity care, started in pediatrics, love families, love moms, love educating families. And that is probably 75% of what we do is sharing education with our patients.
Yeah, so it's great. I mean, I say this every week, but there is definitely a common theme that speaks to the culture of Singing River Health System, and that is this connection that every single person, whether they're a doctor or a professional like yourself, and the relationship that you expect to have with your patients is so notable. And I mean, that's the key to good care these days. You've got to be able to communicate with your patients, don't you?
Absolutely. Communication is really what makes healthcare work. From physicians to nurses to patients, we need to be open and communicate to make sure that things are safe and that people are, in my case, enjoying the care that they get.
So in your career, if you think about it, so 40 years as a registered nurse, 35 years and focused on women and children's health, you've seen a lot of advancements over those years, haven't you?
Well, yes. And a lot of things circling back.
Really? It's interesting. What's circling back? What do you think about when you say that?
I think about, 20 or 30 years ago, we didn't do a lot of epidurals. We did a lot of natural birth, and then we went through a lot of medicated, and now we sort of mix them. We mix that more natural birth and people making choices for themselves and choosing the way they want to give birth and where they want to give birth, and also using interventions like epidurals and pain control. But it's fun to see people going back to that kind of planning what they want to do and really giving themselves a joyful experience.
So you're a proud grandmother of 5 grandchildren.
Yes, I am.
We have 4 I have 4 grandchildren myself, my wife and I. It's like life is coming full circle. It's a wonderful opportunity to enjoy what life has to offer, having grandchildren, doesn't it?
Absolutely. Absolutely. Yes. We just had a vacation with the whole family, and my 3-year-old grandson, who isn't always my biggest fan because when I come, mom and dad leave, we spent the day together at amusement park, and he said, "I just love you, Yaya." Made my whole vacation.
Yeah. I like that. I like that. I think we actually even considered that name at one time for my wife, Ann, but GGB got nailed by one of them, and it stuck, and so she is now GGB. I'm not sure what it's supposed to mean, but that's what the baby said, and now is what it's actually on her card tag, GGB. So it definitely stuck. Listen, if you think about maternity care at Singing River Health System, And what you guys have done, the use of technology to help make the relationship with patients as best it can be. You think about the sort of team approach that you're using, the advancements and the suites that mothers can stay in to give birth and all of that. It's it's a full experience that you've really worked hard to improve over the years, isn't it?
Absolutely. So we work on what we call maternal safety bundles that focus on specific areas like hypertension, primary C-section, discharge. We're working on a bundle now that kind of bridges from what happens when I leave the hospital. Do I have an appointment? What am I supposed to do? When do I take the baby back? We're sort of starting to bridge that gap for people. That happens, I think, as families get less connected. We don't have that extended family, that guidance that we had. We try to bridge that gap for people and make sure that they understand the next steps when they go home.
Yeah, it's an easy step to forget. I mean, it's in some cases, particularly with first birth, it is a life-changing experience, and not everybody has family members around that can help. I mean, some need that support, don't they?
Absolutely, yes. And we're able to connect them to the community resources as well as even something simple as making their next appointment kind of takes that off their mind. And it's very difficult to remember everything you've been taught when you've just had a baby because your mind just goes blank and you don't even remember what day it is all of a sudden. So it's very nice to have people kind of putting those next steps in front of you to help you out.
Well, listen, we're familiar with childbirth, and in most cases, it's such a natural, beautiful, healthy part of living. But every now and then, a mother's going to have challenges. You spoke to some of the interventions that might be available to mothers, and from time to time, you have some of the infants need special care. So, what has happened at Singing River Health System over the years to maximize neonatal care?
So, one thing that you would be surprised maximizes their care is to do what we call baby friendly. So, we encourage moms and support moms in their choice to breastfeed their babies, which improves mom's health and baby's health tremendously. We also do what we call rooming in. We put the baby skin to skin right after birth. This stimulates hormones that help the baby to regulate their heart rate, their breathing, their blood sugar, and does well for mom. But if those things, a baby needs intervention past that, we've got a level 2 nursery and very well trained nurses that can take that, and nurse practitioners, physicians that can take that next step in supporting a baby that is not kind of getting it done on their own and needs a little support.
So, talk to me about level 2. Explain that level of infant care.
Sure. So we're not a level 3 nursery where you would have ventilators and blood pressure drips and that sort of thing. What we can do is stabilize them, support their respiratory. If they're breathing on their own and they need some additional support, we can do that. If they need some tube feeding to support their oral feeding until they can take everything they need, we can do that. If they need some antibiotics, we can do that. And most of the time, that's all a baby needs is a little respiratory support to kind of get over those first 24 hours, and then they start to turn around. And we can take care of babies that are born early and just need some help feeding and growing. They need some additional support. They don't need to use a lot of energy eating by mouth, and so we feed them by a tube and kind of gradually get them to where they can take all their feedings by mouth.
I was always surprised with how small some of those babies are. Those that are born prematurely. I mean, what's some of the smallest ones you've seen go through your level 2 care?
Well, certainly we've had them, around 2 pounds. Now those babies, anything under 4 pounds, we wouldn't keep here. It's just they're not stable enough for us. But we've certainly had lots and lots of tiny babies born with us. We've stabilized them and sent them on to a higher level of care. We can take care of anybody when you come in, but we prefer that they be born in the environment that has the best support for that baby.
Yeah, that is for sure. Hey, when we get back on the other side, we'll talk a little bit more about Singing River was the first system in Mississippi to implement team birth. And
Yes.
we'll talk a little bit more about that on the other side, so we don't lose that. But it's literally a team approach. I mean, you huddle around the mother, and you're trying to guide and help them through the process, aren't you?
Absolutely. Yeah. We, to prevent maternal mortality and to promote equity in healthcare, we really need to promote this idea of giving mom a voice. She has a voice in her care. She has options, and she has a right to be educated about what's happening around her and to ask permission. Certainly, we talk to moms about what an emergency situation is and what we might do in an emergency situation so that she wouldn't be caught off guard. But for the most part, a conversation about what makes her comfortable, what makes her feel safe, what interventions are necessary to promote a safe delivery for her and her baby.
We're talking about maternity care at Singing River Health System, and we're visiting today with Lori Weimer. And when we come back on the other side, we'll dive down a little bit deeper. We'll see you after this break. Welcome back to the Ricky Matthews Show for Singing River Health Talk. It's Wednesday, the second half of the show, and that's what we do on Wednesdays. And it's really awesome because we really get to meet such a wide variety of professionals involved in healthcare in coastal Mississippi. And what we learn from them is really important. And today is no exception. As I mentioned at the beginning of the show, Singing River Health System has delivered 65,000 plus babies since 1931. So that's a lot of experience. And we're visiting with Lori Weimer today. She's actually the manager of labor and delivery in the nursery at Ocean Springs Hospital. And she is a patient care manager. She's been in nursing for 40 years and 35 years in women and children's health. And that gives her some bona fide credentials, that is for sure. Hey, listen, before we went to break, I mentioned that Singing River is the first system in Mississippi to actually implement team birth, an evidence-based model developed in partnership with Adrian Labs and March of Dimes that fosters really proactive communication and shared decision-making. That's essentially what you were talking about before we went to break, but you didn't put the name to it. But it's a very organized approach, isn't it?
Absolutely. It is an organized approach. Ariadne Labs developed this approach to give moms a voice, to promote equity in healthcare, so that we take the same approach to every mom. Every person has their own individual needs, but we need to address those moms in a way that they feel free to express those needs and desires, and that they are heard when they come in and begin a labor with us.
So like a maternity experience in the past might be that a woman comes in to have her baby. And it's almost like
Right.
a surgical procedure that doesn't require a lot of communication. This is literally the opposite of that, isn't it?
Yeah. It is quite the opposite of that. Absolutely. This is an experience that a family will never do again, no matter what baby they're having, number one, number four, whether they are experiencing a loss. It's something they will never experience again. And so it's up to us to make sure that that experience is the best that we can make it, both from our end, from safety initiatives, and from mom's end, her perception. How is she perceiving her care? Does she feel safe? Does she feel heard? Those are important things that we didn't always take into consideration, I think, 30 years ago, but now they're important and they make people feel secure. And that's what we need to do.
See, Laura, in the old days, what happened as well is the baby would be delivered and go to the nursery. And then the mom would,
right,
I guess, see this as recovery time or whatever. It's not that way anymore, is it?
No, it's not. We follow the data and the research, and it says that moms and babies recover better together. They need to stay together. The hormones that are released in a mom and a baby at that time when they're together and they're skin to skin, those are the things that help a baby recover and begin to breathe better on its own, regulate its heart rate, regulate its blood sugar. Also for mom, helps her to produce milk, help her produce oxytocin, which is the love hormone. So everything starts to feel a little better when we stay together as mom and baby.
Childbirth and breastfeeding classes is a part of what you guys do. Are all of y'all involved in those classes?
I have some key nurses that do that education, as well as our lactation consultant does those classes as well. All of our staff are educated in basic breastfeeding, how to help mom get that started. And of course, our labor nurses are very good at educating moms throughout that process. So we have people in place to do that education.
I noted that Ocean Springs Hospital, where you are, has been designated as a Blue Cross and Blue Shield of Mississippi as a Blue Distinction Center of Excellence for Maternity Care. That has to be something you guys are super proud of.
Right. That's something that we are working to maintain. Those qualifications get more and more stringent, and we are rising to the occasion and making sure that we have the newest things in place. There's a new requirement that we screen for social determinants of health, things that are in your environment. Can you pay your bills? Can you get to your doctor's appointments? Do you have enough food to eat? Those are things that we have never addressed 30 years ago that we are looking at with every single patient now, as well as people who have drug issues. There are so many people that, addiction is a disease. And so we need to be treated like that. And so that's what we look at when moms come in. Do they need help? We have resources for them to get help. So those are things that 30 years ago we would have never talked about.
What's interesting, Lori, is you mentioned many times during the conversation about evidence-based care. Using statistics, understanding what do the numbers show us the best practice should be, and then working hard to implement the best practice. But it's a very data-driven world we're in today, isn't it?
It is. I spend a lot of time on data every month and looking at our C-section rates and how we compare to the nation, which I have to tell you are very good, and looking at our breastfeeding rates and how are we doing? Are we encouraging moms to give that best food to their babies? So we look at a lot of data. We use our national guidance from A1 and ACOG to set those standards so that we can give the best care and compare nationally to the care that you could get anywhere in the country.
Well, at the end of the day, what happens when you use data, just like when you're running a business or, playing golf or playing football or running a maternity leave, the bottom line is that evidence-based care is going to lead to better outcomes. And your goal is for there to be a maternal infant outcome that is something you can be very proud of, and that's what happens when you focus on the data. It's been a pleasure to spend some time with you, Lori.
Thank you so much.
This has been Lori Weimer from Singing River Health System. This has been Singing River Health Talk. Hope you enjoyed today. Every conversation is like this, full of so much wonderful information, and you're hearing from a committed professional, and that's very clear. Listen, have a great day, and we will see you tomorrow.